Let me now report that in the last 24 hours, we have tested 674 samples. Out of these samples, 11 have tested positive for coronavirus disease. And so we have now passed the 200 mark. Our figure stands at 208 persons tested positive in our country. All the 11 are Kenyans. 4 have a history of travel from the United Arab Emirates. 6 are male, while 5 are female, aged between 1 year and 42 years. The spread of the cases with regard to their counties of residence is as follows: Mandela, 4, Mombasa, 3, Nairobi, 2, Nakuru, 1, and Machakos, 1. 4 of the cases have emanated from mandatory quarantine centers, while 7 were picked by our surveillance teams. Over the same period, 14 more persons have been discharged from hospital after successful treatment. And 1 other positive case has also turned negative after a mandatory 2 tests. Cumulatively, therefore, we have 15 new recoveries in the last 24 hours, bringing the total figure of recoveries to 40. We have unfortunately also lost 1 more patient in Nairobi, bringing the number of deaths to 9. Fellow Kenyans, we are aware that the burial of a COVID-19 disease victim in Siaya County has raised some concerns. This is an issue that we are currently addressing together with the county government of Siaya in line with public health and sensitivity to the dead are concerned. However, I want to inform the country that moving forward, there will be challenges. I want to say in an honest term as I can, and be brutally honest, that our cultural practices on how we dispose the bodies of our loved ones may not be practical in an extreme situation. I therefore want our people to be mentally prepared and to accept that COVID-19 victim bodies shall be disposed in a manner that protects the living from infections and in accordance with the Ministry of Health burial protocols. Indeed, our economy has been adversely affected, business plans interrupted, jobs and livelihoods have been lost. This is now our new normal, unfortunately. However, we can turn around this situation within a short time if we strictly adhere to what we have said.
When will the schools open? I think your answer is as good as mine, but in order to allow the nation to become, you are aware that our facilities are being utilized for the time being to control the coronavirus disease with very good results. extremely good results because we had projected about 5,000 at this time, and we are only at 200. But people should have peace because we are working on various modalities. When the time is ripe, we shall tell you the various options. Being a Luo from Siaya, I would like to pronounce myself on the issue of the burial at night, I think yesterday. What is our goal? Our goal here is to ensure that the disease is controlled. And we have given various protocols which must be done. And there's a very big risk of people leaning towards culture and forgetting that what has been done is in the overall interest of the immediate family, the extended family, and the family at large. So I would like our people to bear that in mind as you condemn or have anything to say.
We're working hard as a ministry to make sure that we have sufficient capacity in terms of internet so that people can be able to have the connectivity and video conferencing facilities that exist. I know we had discussions, the president launched the balloons, hopefully those will come in time, and they should be able to allow us, Professor Magoha, to even have all classes in the country be conducted even through the video conferencing and infrastructure facilities that we're putting in place. This will help us as a country both in terms of saving money, but allowing people to work from wherever they are and ensuring that we have the distance, social distance that we need. But economically also we are saving a lot of time, we're saving a lot of money, and this will help us even in the long term, even after this COVID pandemic that is actually ongoing. At the moment, it is still not clear how long this pandemic will be, but we need to prepare and be set, and therefore I want to even thank the mobile operators for the amount of support they have put in, including the network providers, to ensure that we have sufficient bandwidth available in the country for those that want to be able to continue to work from home, to work from their mobile devices. There's plenty of work that is now available online, even in the international communities. So as a team, we're working together on the Ajira platforms just to let people know where these jobs are and where they can actually be able to contribute and still earn some money.
Where we are having a lot of challenge in terms of behavior change, in terms of the call for social distance, is still in the counties, especially the rural counties. People at the markets, I'm glad churches and mosques have been closed. That has helped a lot. But at the market, the open air markets, and in towns, in supermarkets, in the rural areas, people are not very serious. And since now we are starting to see cases appearing in the counties, our worry now is actually those counties. Mandera has had 2 cases. Today it has had 4 more cases. It has 6 cases. And slowly Machakos and the rest are also starting to have cases. Unless those counties behave the way Nairobi behaved. Nairobi behaved very well and kept their numbers low. But because now rural counties are still thinking this is foreign matter that has come to Nairobi and is still far from us, the behavior in rural counties is still very worrying. And therefore, and now the disease is slowly moving in that direction. And therefore I request, or rather I ask the county emergency response committees to put more effort. The curfews have assisted a lot, but during the day, we need to push harder. The issue of washing hands is doing very well, but social distancing in the markets especially is still a worrying trend.
Probably, like today you said, you are urging them not to really